Hello, my name is Akeem Henry. Welcome to Mission to Medicine. Today I'll be doing a special interview with Dr. Kelechi Okoroha. He is an orthopedic surgeon that is fellowship trained in hip arthroscopy and also sports medicine at the Mayo Clinic. I hope you all enjoyed this video as he's going to drop some important tidbits, some gems to help inspire the next generation of physicians. So you're an orthopedic surgeon. What got you interested first off in becoming a doctor?
Yeah, so it's a great question. I have a medicine background, so my dad is a family practitioner. So I was always interested in medicine in some aspect. To be honest, I wasn't originally interested in medicine. Growing up, I wanted to be a basketball player. So like every kid that dreams about basketball,
Right.
I wanted to play in the NBA. So that was my original dream growing up. As I went through undergraduate and college, I was interested in medicine. It was kind of the backup plan. And as my basketball career faded, I started becoming more interested in medicine.
Okay. So when you got more interested in medicine, was there a turning point? Were you always a good student, or did you have to focus a little bit more on academics? How was that transitioning from going from sports to buckling down on your books?
Yeah, surprisingly, I was a really good student. For me, it was competitive. So I was always a competitor. So I competed on the court and also in the classroom. So I'd always compete with all my friends to see who could get the highest score on test.
Yeah.
And that's what kept my grades pretty well. So I was always a good student.
Okay. And so when was that time period of you going to college and then studying for the MCAT? How was it being pre-med and then the MCAT transition, studying for that?
Yeah, it was. I kind of did it at the same time. So as school was ending, I knew I was going to be drafted in the NBA, but I thought I could, go overseas or do the G League. It was a D League back in the day, and so I was doing them at the same time. I was like, okay, I'm going to try basketball, but if it fails, I want to take my MCAT and everything to be able to get into medical school.
For someone who's right now in that college period or transition from high school to college and may be stuck on maybe a career goal that they had and then eventually they have to pivot or choose something else, what advice would you have to give them for that transition period? How did you go from navigating, like, I really wanted to become a star basketball player to now, all right, I'm going to be a doctor?
Yeah, great question. I think it's tough because whenever you're going to be great or elite at something, you have to have the utmost belief that you're going to be able to do it. So it's hard to say, I want to be an MBA, I think I can do it, but also have a backup plan, but you have to. And so although I had that utmost belief that I was good enough to be a basketball player, I said, let me make my grades high enough and let me have this backup plan, and backup plan was a medical school. And so what I ended up doing is, as I was getting interviews or applications to go overseas and do the G League, I also took my test and I applied to about 3 medical schools.
Okay. And so what was that experience like, I guess, going through the application process for medical school? Was it straightforward? How did you prepare for that?
The answer is I didn't really prepare for it well. I missed a lot of the deadlines for medical school. And so by the time I applied, there was only a certain number of schools that were available. So I applied to Howard, I applied to Meharry, and I applied to UConn, and I interviewed at all those places. So it's probably less stressful than most people because I only had a certain amount of places where I could apply. And I just shot my shot at all 3.
Okay. So how was that experience entering medical school, your first year of medical school? If you can think back to that, what was that like for you?
It was great. It was also at a time where I was still trying to figure out basketball, so that was in the back of my mind. But it was very interested going into medical school. I was interested in neurology because I like neurology in undergraduate. And so I knew I wanted to do something around that field.
Okay, so then if you were interested in neuro going in, when did that pivot started to change to starting to look into orthopedics?
Yeah, I think that was at the end of my first year of medical school.
Okay.
So at Howard, our second semester, we started getting into the anatomy lab. So I was dissecting cadavers, and I was like, I'm really interested in this. I like anatomy. I like using my hands. And so from there, I knew I wanted to be a surgeon, and then orthopedics and sports medicine kind of bridged that gap basketball-wise.
And where did you attend for medical school?
Howard,
Okay.
D.C.
Did you have any doubts in your mind about potentially going into ortho? Was there any reluctance to whether or not you could do it?
Yeah, I think there was a lot of reluctance. I didn't really understand what orthopedics was going into medical school. I know some people already have it planned out in high school and undergrad. And I discovered it in my first semester. And
Okay.
so if you know anything about orthopedics, it's one of the most competitive residencies you can go into.
Yes.
I did not grasp that in my first year. And so what happened is, in my first semester and even the start of my second semester, I don't think I was as competitive as a student. And so I kind of fell into the mid-tier of our medical school class. And then at the end, when I realized orthopedics, you had to be really competitive, I had to work my way up the hill to get back into the top of the class.
What were some of those things that you did to work your way back up the class? Like, what strategies did you use? What motivated you? What drive you? Because, you know, sometimes you might start off a little weak first year of medical school or second year of medical school, but what were like the factors that you kind of weighed to like get it going so you could be more competitive?
It's just about drive. And so for me, if I know what needs to be done and you say, hey, orthopedic surgeon, you need to be in the top 10 of your class, you need to honor all these courses, then I know what I need to do. And so from there on in, it was a competition again. And that drove me back to my basketball. And now I have to be the best student. And I know exactly how to be competitive. You just have to lock in, you know, put your head in the books, and that's exactly what I did.
And I understand from, you know, pursuing a competitive specialty in medical school, it's one thing to have the grades, it's one thing to have the drive and the personality and et cetera, but there's also about this networking aspect as well that's very important. Do you have any mentors in the field of orthopedics in medical school when you were going through that time?
Yeah, I have plenty of mentors, and like you said, networking is a key to that. So you want to develop relationships with as many people as you can in the field that you want to be at. So if there's orthopedic surgeons you can connect with, orthopedic surgeons you can shadow. You want to get as many of them as you can, pick their brain, get their experience, and help you on your path.
And how did you go about networking, I guess, to meet your first mentor in medical school?
Yeah, well, the great thing about Howard is it's a predominantly black institution, right? So there's several black orthopedic surgeons there. So I connected with them. I was able to go over to the hospital, schedule meetings, and meet them. Also through the Nth Dimension program, I was set up with a mentor, Robert Wilson. He was actually at Providence at that time, and so I was connected with him over a summer in between my first and second year. Got to shadow him and develop that relationship as well.
Speaking of Nth Dimensions, I'm an Nth Dimension Scholar this year, the 2024 cohort. And Dr. O, what cohort were you a part of for Nth Dimensions?
To be honest, I don't even know. You have to go back. It's probably like 2008, 2009, something like that.
Well, Nth Dimensions is a program that's geared towards getting underrepresented minorities in the field of competitive specialties such as dermatology, orthopedic surgery, and radiology. And it's really geared towards providing us opportunities to mentor and get shadowing opportunities. So it's really great this summer. We get to do that here at the Mayo Clinic. So what were some of the most challenging experiences that you've had so far in your orthopedic training?
Well, orthopedic training is really challenging. If you know anything about it, it's a 5-year commitment. It's 5 years out of your life. And so the time commitment is probably the biggest struggle you have to deal with. You know, you're spending a lot of time in the hospital, you're on call, you're missing events with your friends and your family, and so just kind of balancing that and trying to stay present in your friends and your family life is probably the hardest thing to do.
And so when you were back in medical school, like weighing the options between different residency programs, were you thinking about any of those aspects that you just mentioned?
I was. I was. Like I said, I was interested in neurology and nerves in undergraduate and medical school. But in thinking about surgery, neurosurgery is a 7-year residency program. Plus, if you want to do a fellowship, you're looking at 8 years. With being an orthopedic surgeon, total training is about 14 years, so you definitely don't want to lengthen that if you can avoid it. So I quickly made the decision not to do neurosurgery because of the length of time.
Today, like 2024, we hear a lot about lifestyle, people work-life balance. What's your thoughts on that, and how do you kind of avoid burnout in your practice, I guess, from when you were in medical school to like now as an attending physician?
Yeah, I think work-life balance is really important. It's harder to do as a student and as a resident than it is at attending, but it's very important. And so for me now, I'm always conscious of what's taken away from my time. And when you talk to people, most people will value money over time. And I think you have to take a step back and value time more than money, because time is the most important, valuable that you have. And so if I can find ways now where I can buy my time back or get more time over the money, that's what I really try to do.
And how did you, what advice would you give right now to a medical student that is in between of picking a specialty, whether or not they want to go surgery, medicine, the different subspecialties? What advice would you give them?
Biggest advice I would give to someone picking specialties is pick something you love and you enjoy to do. Some people will go into joints and I talk to some of my co-residents and like, well, I think the aging population is increasing. It's going to give me some job security. When you talk to people that want to go into spine, they're like, oh, this makes the most money. And that is an aspect of it, but you want to do something that you enjoy doing and that you enjoy doing for the next 30 to 40 years. And so for me, that's sports medicine.
Yeah.
I was an athlete. I played basketball. So I know at the end of the day, I'm going to enjoy interacting with these patients that were like me growing up. I'm going to enjoy covering, basketball, football games. That's something I can do, not necessarily because of the pay.
Can you describe a typical workday like for you now?
Yeah, so typically I have clinic Monday through Wednesdays. And so you're in my clinic now. We go from 8 in the morning to 3 p.m. in the afternoon. Thursdays is my operating day, so I'll go to Rochester, I'll operate, and I'll come back. I also operate every other Wednesdays, and then Friday is my kind of administrative day, and I do anything I need to catch up for the week, and I also deal with Timberwolves activities on that day.
Okay. And what cases do you see frequently most?
I operate on 3 joints.
Okay.
I do knee, hip, and shoulder. So I do arthroscopic cases on all 3 of those joints, and I also do shoulder replacements. So I'd say most commonly I'm dealing with the hip and the shoulder, but it's probably a third of each.
Okay. And which one is one of your favorites?
Probably hip arthroscopy or shoulder instability surgery.
And why is that?
I just think it's something that's interesting. I think hip arthroscopy is not really mainstream yet. So we've been doing it for the last 20 to 30 years, and I like being involved in areas that I can improve upon. So I think there's a lot of areas to improve on in the hip. And then the hip is similar to the shoulder. It's a ball in the socket joint. It has a labrum, and so I just extrapolate techniques and procedures for each.
Okay. Right now, the field of medicine, everyone is, pushing. Everybody needs to do research, be involved in research. What ways do you stay, up to date with the advancements, utilizing research?
Yeah, so the easiest way is just to become a member of some of these associations. So AOSSM, and then you get their journals. So the Journal of Arthroscopy, AOSSM, the Yellow Journal. And I like to read the articles from each month, and that keeps me up to date with the advances. And then also contribute to the research. So if you see an article and you have a question about something, hey, let's evaluate that. Let's find either some basic science research, outcome data to try to determine patient outcomes and if patients actually improve after surgery.
Are there any particular advancements or technologies or innovative technologies in the future that you're really excited about in your field?
Yeah, I think there's a lot of advancements in the field of orthopedic surgery and sports medicine. I think one that I am excited about is arthroscopic glenoid reconstruction. So patients with shoulder instability and bony defects of the glenoid or the socket of the shoulder joint. In the past, we've done either open transfers of the coracoid, called a ladder J procedure, or we've taken cadaver tissue and transferred it to that glenoid or that socket to increase the bone there. And although we've done it openly in the past, in the future, we're now able to do that arthroscopically and minimally invasive. And we're still kind of in the infancy of that, and I'm very excited to contribute to that and find easier ways to do that.
That's awesome. Can you recall a particular challenging case that you've ever had, and how did you work your way through that surgery?
There's a lot of challenging cases. Any specific question about a case or?
Just anyone that you could think of that you could just recall that it was a moment that, all right, I had a plan going in, and maybe when I got there, I had to pivot on my foot and do something different.
I don't think there's any particular surgery that just jump out on me, but what I would say is whenever you go into surgery, you have to have a plan A, a plan B, and a plan C. And so my thing is I always have multiple plans depending on what's going to happen in the case. So if your suture anchor pulls out, a screw pulls out, you have some back wall blowout on an ACL, there's a lot of tips and tricks that you can have to still focus on the case and get a successful outcome.
Okay. As far as patient care, what are some misconceptions would you say a lot of patients have about orthopedic surgery?
Well, I think the most common misconception about orthopedic surgery is that we're foot doctors. So,
Wow, I never heard that.
the most of the times when you talk to the general populace, they'll be like, orthopedic surgery, oh, you take care of feet. I'm like, no, not really.
That's funny.
That's a podiatrist. But yes, there is an orthopedic surgery foot and ankle division that takes care of foot and ankle. But orthopedic surgery is the care of bone and musculoskeletal issues.
Right.
So basically bone and muscles.
Okay. How do you go about patient education? Explain the patient, their condition or diagnosis, and your option treatments for them.
Yeah, patient education is very important. So when you're seeing your patients in the clinic, you might be tempted to go into these complex descriptions, but you really got to break that down. And my athletes help me really with that because, you know, a lot of times they didn't go to college or 1 year of college, so their level of understanding is much less than the general population.
Okay.
So when I'm speaking with my patients, I try to break it down to the simplest terms that I can. And even then, I always have patient handouts that breaks it down into layman's terms. So even if they forget something I'm saying, I have a packet to kind of review their information as well.
And I've seen you do that in clinic, and you definitely stay true to that. You give them good eye contact, give them the brochure so they can look it over when they go home. I think that's really helpful because not only do they hear you say it, but they can also go home and look at the information themselves.
Yeah.
That's good. What qualities do you believe are essential for a student that wants to pursue orthopedic surgery?
So there's a couple that jump off the top of my head. I think you have to be dedicated. It is a long path, and it's a path of uncertainty. It's very competitive.
Yes.
So you have to be a competitor. You want to have to be the top of your class. Obviously, you have to be intelligent. I think you have to be compassionate and caring.
Yes.
Taking care of patients, especially surgery, you have to have some level of compassion and ability to take care of patients. Those would be my biggest ones.
And what would you say is a good mentor right now for someone that is, you know, in medical school who wants to pursue a competitive specialty such as ortho? How would you tell that person that you need to find a good mentor? What qualities should they look for?
Okay. Yeah, I would look for a mentor that you want to be like. So you want someone who's in the field or the specialty that you want to be in, someone that you think has achieved a lot of things in their career, and someone you can ultimately learn from.
Okay.
So all my mentors are people that I wanted to be like. You know, like, I want to be like this, you know, surgeon. I want to be like Dr. Wilson or whoever, and that kind of guided me to gravitate towards them.
Got you. If you could go back, what would you tell yourself before starting orthopedic surgery? What advice would you have wish you'd known before?
Yeah, I mean, what advice would I give my younger self? I'd probably tell myself it's a long path. It's a long and a treacherous path. You know, 14 years of schooling. There's going to be trials, tribulations. There's going to be setbacks. You're going to underachieve on things that you think you want to. But I think at the end, the ultimate goal and completing your residency and fellowship and becoming an orthopedic surgeon is one of the greatest things you can do.
Awesome. If you couldn't practice medicine anymore and you couldn't do orthopedic surgery, what would it be? You can't say basketball.
I mean, that's the answer right there. I'd be a basketball player.
Basketball?
Yeah.
Okay.
If I couldn't be a basketball player, I mean, there's not many things that I love besides orthopedic surgery and basketball, but I'd probably do something like traveling.
Traveling.
You know, I love to travel, so if I could find some way to incorporate travel into getting paid, I'll probably
Influence their life.
Yeah.
Got you. What has been the most rewarding experience thus far in your career?
Seeing a successful patient outcome is definitely the most rewarding experience, and it's kind of like that adrenaline that you kind of want to get back to. So I think the most rewarding experience is whenever I have a surgical patient, like a young basketball player, a young football player, a young hockey player, they have an injury, I get to evaluate them on the field. So I'm able to see that level of pain, that level of frustration. I'm able to empathize with them, calm them down, give them that plan. We go to surgery. I'm able to get a good sound surgery, stabilize whatever joint I need to.
Yeah.
And then they get back to doing their sport. So I'm able to witness them at their worst and take that pain and that frustration and get them back to doing the things that they love. For me, that's like, you know, the number one joy in the world.
That's awesome. It's amazing. How do you see the field of orthopedic surgery evolving?
Yeah, so orthopedics is always evolving. There's always new techniques. There's always new ways to do things. I think in the future, things are always transitioning from open to minimally invasive to more minimally invasive, right? So like I talked about with the shoulder, you know, we're doing open glenoid reconstruction. Now we're talking to minimally invasive. We're having smaller incisions, you know, quicker techniques. And in the future, I think we're going to be doing things through very small incisions and with robotic assistance as well.
Okay. Do you have any last final departing words that you want to leave to the audience and viewers? Someone who's in medical school, aspiring orthopedic surgeon, what would you want to tell them?
Yeah, so my last bit of advice is don't let anyone tell you that you can't do something. Something my coach used to tell me is never let anyone expect more from you than you do for yourself.
Wow.
You know, so you should always expect more. You should always expect to be better. No one should come to you and say, hey, I expected you to do this and this was lackluster. You should always expect more from yourself. And then number 3, strive for greatness.
Awesome. Thank you so much, Dr. O. Appreciate you for coming on.
No problem.
Hope you all enjoyed this interview. Remember, it's not a marathon nor a sprint, it's a mission to medicine. If you made it this far in the video, that means you made it to the end. Thank you so much for sticking around. I hope you all liked the video, was able to gain some knowledge, be able to get some advice and inspiration from Dr. O's message. Please like, subscribe, hit the notification bell to be updated on new video content when it's uploaded to the channel. And remember, it's not a marathon nor a sprint, it's a mission to medicine.